So I'm Lisa Riley and I'm the CEO of Centre for Dentistry.
And I'm Cathal Hayes and I'm Managing Director for Centre for Dentistry and I'm a dentist as well.
Great, thank you. Are you both ready to start the interview?
Yes, we are.
Great. So how regularly should people be going to the dentist?
In general, we would suggest every 6 months is an appropriate time period to go and visit the dentist. But you can discuss that with your dentist after seeing them for a few appointments. If there's more risk of problems, the dentist might suggest an increased frequency, or if things are great and there's no major issues, then maybe every 9 months or a year. But in general, to begin with, we would say every 6 months.
And why is it so important to have regular checkups?
Because prevention is so much easier than a cure. So the idea of regular checkups is to prevent problems from arising. Because if we can prevent them, then we don't have to go through the hassle of doing rest fillings, treatments, and so that's reducing cost as well. So we really recommend routine checkups to catch anything when it's small and prevent things from happening at all.
And why are people scared of the dentist?
I think there's lots of reasons. You know, we see many patients based inside Sainsbury's, so we have an environment where people feel that they can wander into the dental practice and have a chat, and it's a little bit like a confessional, you know, where people say, please forgive me, Father, I haven't been to the dentist for 20, 30, 40 years. And the reasons that people are not going is quite complex, but in principle, some of it's around fear. If they haven't been for 40 years, you know, dentistry's changed significantly in that time, and it's great if they can come back and experience the new version that dentistry now is. Sometimes it's about access and the fact that I've got to give up time from work or take the kids out of school, and that puts people off. And again, you know, practices like ours are trying to help that by opening from 8 o'clock in the morning till 8 o'clock at night so that people don't have to do that. And sometimes it's a fear of what it might cost me. And again, prevention is better than cure, because if you do attend regularly, the chances are that you'll spend a little bit of money now rather than an awful lot of money later.
Yeah, so what advice would you give to people who are scared of the dentist, who don't want to go?
Come. So, you know, what I'd say to you is that the only way to overcome that is to a certain extent, desensitise yourself. So again, one of the things that we do in our practice is we say to people, look, every time you come into Sainsbury's, pop into the practice, have a cup of tea, or if the chair is free, one of the chairs is free, go and sit in the chair, get used to that environment. And over time, it will become normalised to you. And I think lots of people have this memory of going into practice which is very quiet, has a certain smell, and they can hear drills, and you know, that gets them already feeling quite fearful. So again, if you come into our environment, again, because we're in a supermarket, the ambience is just a little bit different. But whichever practice you go to, don't put it off, because you don't want to get to the point where you're in crisis or you're in pain, because it will just reinforce that fear that every time you go, something dramatic has to happen to you. It's much better to go when you're literally going for a checkup and a clean and polish, and you get used to just non-invasive procedures.
And could you give us an idea of the statistics here in West Yorkshire and how it kind of compares to national figures?
We can do. I think generally in the north, people are more proactive than they are in the south, funnily enough, in terms of attending a dental practice. So that's a positive thing. But nevertheless, across the UK, we still have 40% of people not going. I think in the studies that we did, we had certainly more people in your region that were attending, but nationally, I think it's unfortunate that so many people don't go, and so many people don't take their kids. And if no other message we get across today is, even if you don't want to come, please bring your children.
And do you think that the celebrity culture of teeth whitening and getting things done to the teeth in general has had an effect on people not liking their own teeth?
I'm not sure whether it's a negative. I think actually it's probably slightly more positive. I've got 4 kids, and I certainly know amongst them, and they're sort of in their 20s and teenagers, they're much more acutely aware of straight, white, nice teeth. And if that means that it makes them go to the dentist and think about their oral health, then I think that's a positive thing. And I think whatever age you are, you can aspire to that. There's no reason at all. But typically, if you're going to come in for aesthetic work, you're going to have to get healthy first. So I think it's a very positive thing.
And what are the options for people struggling to find time to go to the dentist?
I think more and more practices are aware of the fact that they have to be open longer hours and more flexible for people finding the time. As I said, we open from 8 in the morning at Centre for Dentistry till 8 o'clock at night, and we're opening at the weekend. So hopefully that allows people opportunities to attend in the evenings or at a time to suit them.
Yeah, and hopefully everyone else will kind of follow suit with you there.
I hope so.
How do you think that people can have a more positive experience at the dentist?
Again, that's to, I suppose, come frequently, not just when there's problems, but to come for routine examinations, and to build that relationship with the dentist. The dentist wants to build a relationship with you, build trust, and that has a really, really positive effect. And also bring your children from very, very early ages. So we would always say from 6 months old, from when the first teeth start coming through, bring in your kids, so that from the very beginning, coming to the dentist is always a positive thing.
That's great. I think that's everything I've got to ask you. So thank you both very much for your time.
Thank
Perfect.
you. Thank
Thank
you.
you. Bye.
Bye-bye.